Hi, I'm Emma, second year physiotherapy student. I may well have met many of you during the 10-week work placement here. This video is about exercise. So physiotherapy and occupational therapy can help to improve cognitive function and mood. And exercise can actually help to decrease the risk of heart disease and diabetes, strengthen your bones and muscles, and helps to reduce stress. By taking part in physiotherapy-led exercise, it increases your physical activity levels and it can reduce cardiovascular risks. So this means that we're helping your heart and lungs to remain strong and healthy. By doing this, it means that your heart is strong to pump blood around your body and to deliver lots of oxygenated blood to your muscles so that they too can stay strong. And if your muscles are strong, then this will help you with your walking, balance, transferring from your chair up to standing, and also help to prevent falls. Overall, it also means that it's going to help you to stay as independent for as long as possible. And also, if you are asked by a doctor to raise your leg for an examination, then by doing these exercises, you know that you're going to have the strength in your limb to be able to do so. So these exercises that we're going to demonstrate for you are for the lower limb. They're going to be demonstrated by Ruby, who is also our physiotherapy student that again many of you may well have met. We're going to be aimed to be doing 5 repetitions. If you're able to do 10, then that would be great. But if you can only do 5 or 6, then that's super. Before you do start your exercises, please make sure that your GP has told you that it's safe for you to complete them. If you're using a chair that we will be doing today, then please make sure it's sturdy and it's not going to slip. Wear non-slip supportive shoes. And if you feel dizzy or have chest pain or shortness of breath, please stop and call your GP or dial 111. A feeling of slight soreness the day after exercise is quite normal, and it's just a little reminder to say, please don't worry, there's nothing to worry about. Okay, so Ruby is ready to demonstrate the exercises. And again, please go at your own pace. So we're going to start with toe raises. So you're sitting back in your chair with the backrest supporting you. Raise the toes. So count of 5. 2, 3, 4, 5. And then we're going to go on to heel raises. And up to 5. 1, 2, 3, 4, 5. So these exercises are working the muscles in the lower limb. The next exercise is leg raises. These help to strengthen the quads, the muscles at the front of your thigh. And if you want to, you can use weights wrapped around the ankles. So taking the leg out in front of you and keeping it straight. That's 1, 2, 3, 4, 5. And then switch to the other leg. 1, 2, 3, 4, 5. Okay, the next exercise is knee raises. So these help to strengthen the muscles in the front of the hip. So we're going to be bending your knee and raising your leg. You can use your hand wrapped around under your thigh if this helps. 2, or was that 3, Ruby? That's lovely. And then swap over onto the other leg. It's 1, 2, 3, 4, and 5. Okay, the next exercise is hip abduction. So these muscles around the hips help to strengthen the outside of your hip. And if these muscles are a little bit weak, they can actually affect our balance and mobility. And it can also cause lower back pain due to the instability around the joint. So again, sitting back in the chair, taking your leg out to the side as demonstrated by Ruby. That's 1, 2, 3, 4, and 5. And then swap legs. It's 1, 2, 3, 4, and 5. Okay, the next exercise we're going to demonstrate is a sit to stand. So if you are unable to stand up, Ruby will demonstrate the alternative exercise here for you. So if you shuffle towards the front of your seat and just put one leg out in front of the other just to support yourself. And then what you're going to be doing is just rocking forward slightly as if you were initiating the start of standing up. That's it. So that's the alternative. The other exercise is to be standing up full into a full standing motion. So if you were to bring your feet back in together again, and you can use the armrests to help to support you to stand up, or if you have the strength already, then you don't need to use them. And then it's a count of 5. So 1, 2, 3, 4, and 5. That's it. Lovely. So that's the end of the first set. And then you have a little rest for a few minutes, have a sip of water, and if you're able to do the exercises again, then repeat back from the beginning. If you're able to complete the exercises 2 to 3 times a week, then hopefully you should be able to see the benefits, and you'll certainly be helping to make your joints and your muscles much stronger.